everyone, and welcome to our another session. And today we are going to talk about complete Ayurvedic approach for menopause. Last time when I talked about women's well-being from Ayurvedic perspective, after that many our client and one group relate with the women's menopause issues, they approach and ask that, okay, when you talk about Ayurvedic approach to menopause, what is complete approach you are talking about? And you mentioned some herbs and formulation. That's what you feel should be something women should use. And I said, no. In Ayurveda, at no stage our focus is on advising someone some kind of formulation. Advising formulation is only in one component until or unless any of client not interested to follow a complete approach, outcomes will be not possible. You definitely can still see a lot of benefit because Ayurvedic products or Ayurvedic formulations have still very different approach as compared to any other kind of products out in the market or so-called natural product or some other aspect. But still, if someone is coming and asking me as a practitioner, as a doctor, that uh, will you give me some kind of magic pill for this problem? My approach, my advice, my straight answer to them will be no way. It is always good to follow a complete approach and get the benefit. So, on that note, I thought just I will share with every one of you that how one can really look into this menopause issue and start working on them. Because, as we said before, every woman reach in her life to the stage of menopause, and that's where it has three components from our perspective: pre-menopause, in a menopause stage when the woman is going through that, and then there is a post-menopause problem. So, in relation to Ayurveda, how we perceive this problem, as we all understand that according to Ayurveda, our body is governed by three intelligence, and those intelligence are known as Vata, Pitta, Kapha. And as long as they are in a balanced state, they perform their function perfectly. And these three intelligence have their specific function. And then the second element comes up in relation to the each individual's constitution. And then we have another element of understanding that the age factor. So when we coming back to the menopause part is when a woman from a pitta age moving toward the vata age. So pitta age means start from the 16 and hit to the 50. Now, as long as a woman, irrespective of her constitution, is able to maintain that pitta intelligence in a balanced state while living that pitta phase of her life, she can have a very normal transition towards the next phase. And in relation to women that phase a menopause also is a one transition comes up in every woman. And that's why in Ayurveda we call it is a natural transition. There is nothing something specific, nothing something special happening to one woman or the other. So there is no question that a woman has to suffer from such symptom which most of the women face when they are coming up to the menopause. Like first thing is the mood swing comes up, hot flush is coming up, especially at night time, and then they start having an irregularity in their periods. The period can start shortening, heavy bleeding can come up, and their mood swing can really be sometimes very, very difficult to sustain for by themselves. they can be upset, they can be down, sleep disturbance will be there, thinning of the hair can start happening. So all those things, and then many women can actually start putting on weight, or someone might start losing weight, or someone might have an even osteoporosis issue which relate with the bone. So when women are coming to that age that they will be moving toward that menopause stage, and premenopause can start with someone at 40, someone at 45 or 47. That's the time frame they start getting a bit worried about that something might be coming up now in my face, and they start approaching their doctor and or even other kind of practitioner, and they will try to put them on hormonal replacement therapy. But from Ayurvedic perspective, at no stage one need a hormonal replacement therapy, because why you need that? When you are going through a natural process of your life, why you will add some additional external component to support that? You don't need that. You just need to make sure that your bodily intelligence is working in a balanced state. And that aspect will make the things to move very natural transition, and you will enjoy that phase, and you will not have to suffer from those problems which we just talk about. And you don't need to go on the sleeping pill, you not need to take some antidepressant, or you don't need to load yourself with vitamins and omega 6 and omega 12 and so called other um, women's executive pills or different hormones and aspects. So question comes up, what I need to do? Simple scenario is you need to start creating that balance, because in Pitta age, yes, nowadays every woman or most of the women are working women, and they will have a work life, and in the work life there can be a lot of time stressful jobs can be there, environment can be stressful, and then they come home, they have their own responsibility at home, and sometimes other family issues are there, so that can develop stress in their life. And if they are not able to manage that stress, and how stress relate from Ayurvedic perspective, we talk about pitta and vatas imbalances comes up. And that pitta and vata imbalance, when it is there in the premenopause stage, when it is now going through the phase of menopause, it can blow up and lead to those all complications. So whole focus from Ayurvedic perspective is that as long as every woman start observing that some changes in their period or some sudden changes of certain symptoms are start showing, it means they are getting to the premenopause stage. And rather than feeling more panic or more dependent on any kind of supplement, you can easily start observing that if you are not following even up to that day Ayurvedic approach or Ayurvedic program for your well-being, you can start even at that day. There are certain day-to-day regimes, we call them as our daily routine and the seasonal routine, and those routines are very precise for menopause. And if someone can start adding them in their life, they can see that yes, my transition, which was going a bit up and down, is start happening now naturally, and I'm still in the same environment, and I'm still in the same work environment, I'm still in the same sort of stressful situation, but I'm able to manage my problems smoothly, and no one has to suffer from all those problems which every woman is being bombarded that okay, now you are going through menopause, you might be becoming susceptible to high blood pressure, you might have an susceptibility towards the breast cancer, you might get the osteoporosis, and all those things will happen, and you have to live with them. That is not the case. So first regime is for all the women who are looking towards going through this transition phase of their premenopause, if they can wake up in the morning and look at their tongue immediately, what I always have said, that the moment your eyes are open, get out of the bed, go to bathroom, have a look at your tongue. And every woman will find that the back part of their tongue always have a white coating there, and that coating can be a little bit yellowish and dry coating. What is that? That actually is nothing but the reflection of your health in that period, because that is nothing but the accumulation of the toxin which your body has started producing. And now, if you don't take care of that and start eating, drinking, and start doing various kind of exercise, what happens the moment you start doing those, you take those toxins in, and those toxins are the one which will slowly start depositing in different areas and lead us to one or the other problem. So one thing, if every woman during that phase can start 2 3 years ago to make an effort first thing in the morning to brush their teeth. They can use any toothpaste. It is always good to use a natural toothpaste. So best options are always try to use tooth powders, because they are not having any kind of chemical gums or natural gums even to bring up all the herbs. So you can use even a natural powder. Tooth powders are the best to use. And then scrape your tongue with a tongue scraper. And that will help you to minimize the accumulation of the toxins in your system. Even by doing this one thing, I can assure you, you able to control 30 to 40% of some of the symptoms which we are going through that. And then immediately after that, each woman should start drinking in a detox drink, which is very simple. Take a glass of warm water, and in that they need to add half teaspoon fennel seed powder, half teaspoon fresh ginger grated, half teaspoon honey, and half teaspoon lemon juice. Now, what is the purpose of this drink? This drink will act as a scraper and flush all the toxins from the gut before they get absorbed. Because in that period, heat is naturally start getting trapped inside the body of that woman. That is why they can sometimes have a bit of a loose bowel motions, or sometimes they can get even constipation. So in a bit of a chaotic stage she can be. So this drink will help us to expel all the toxins before they get absorbed. How it will work? Ginger act as a scraper, honey act as a binder, lemon act as a flusher, and fennel seed powder will take excess heat from the gut. So that's where your detox drink comes up. Now, the most important regime from Ayurvedic perspective is the one which I'm going to share next. That regime, we call it as a nasal treatment or Nasya treatment. In that, what each woman should start doing is that after the drink, sit on a chair, just relax. You can put your head backward, and your each nostril you need to start putting 3 drops of warm cold pressed black sesame oil. Make sure that you always have to use cold pressed oil. Never use the toasted sesame oil which you get in the supermarket. So you need to use the cold pressed black sesame oil is more preferable because it's more medicinal. So that with the help of a dropper you can put 3 drops in each nostril and then sniff them a little bit, and then you can massage around that area a few times. Now, what is the purpose of that? The major purpose of these drops are, as you understand, we have 2 glands here. We call them as pituitary gland and pineal gland in our medical science. And these 2 glands are considered as our master gland, and they have very specific function to perform in our body when they are in a balanced state. But when they get a little bit imbalance, right, a lot of situations can start happening, and especially in this phase of the premenopause, because these glands, when they are in a balanced state, they secrete many secretions which are very, very beneficial for the nervous system as well as for the body. And at the same time, these are the gland which has a direct control on my other gland. That's where the hormonal balance comes in. This is the natural intelligence of the body which keep your hormonal balance intact. Your bodily intelligence know at what stage what hormone need secretion and what amount of the secretions need. And your bodily intelligence knows that which hormone is now seizing out or secretions are getting affected. So as long as these two glands are in a much more stable state, balanced state, that is where you will find it will perform its job to keep the balance of the other hormones in better state, as well as those poisonous secretions can be minimized in elimination. And those poisonous secretions are ultimately are the core cause which will lead to make that woman to feel sometimes lack of enthusiasm, lack of cheerfulness, don't feel like talking to someone, getting quite impatient and a bit irritable. And then at the same time they can start feeling the hot flushes. They can also have some gut issues. So all those things not coming from anywhere else but because of these two glands. And once she start doing that, within 4 weeks she will start feeling much more enthusiastic, much more cheerful, much more focused, much more grounded. That is what we want to achieve for them. And once they are feeling that way, not feeling fatigue or tired, things will start changing for them effectively, naturally. Then one of the other regime which is very, very important is for them. And naturally that habit start creeping in each woman who is going through this menopause phase, that they naturally start liking towards hot shower. Even though they might say, okay, I am a pitta vata person, so I don't like the heat. But if you look at their temperature in the shower, it is always quite high. And that is a contributory factor towards the problem again, because heat is the one which impact on these glands more than anything else. There are many other factors which can impact them, but this is the one of the most important. So that is one each woman should observe. If their showers are hot, they immediately must stop having hot showers. So many will come and ask me, do I need to have cold shower? I always say never. You always have to have nice and warm, but never ever hot. And sometimes then ask how I'm going to find out whether I'm hot, because I'm a vata person. I love hot shower anyway. So I give them all the time indication that look, when you are going through this phase, two things you need to observe. When you are in the shower, whether you have a 5-minute shower or 20-minute shower, make sure the moment you see up steam coming up, you're gone. The moment you see when you come out of shower, even if you have a small pink patch, you're gone. So these two indications you must keep it in mind. These are your self indicators of checking yourself how you are going. So must avoid that. And then the other very, very important regime is, because when they are in a premenopause stage, there are two indications happening with them straight away with every woman, whether they are a kapha vata, vata kapha, vata pitta, whatever constitution they are. Their body will start becoming quite stiff and tight, and they can start observing that my skin is becoming quite dry. So that dryness, stiffness and tightness can start giving them some kind of muscles pain, aches and other, and then dry skin, even on the face, they can start losing that feeling of glow. And that's where they start hitting, oh my goodness, I am becoming old. And that another stress with every woman, because they can handle everything in their life, but they can never handle that they are getting old, they are losing their that glow on their face. So to counter that, what actually is happening and why that need to be taken care of, and how that need to be taken care of, should I load myself with a lot of costly moisturizers and other things, or put some foundations layer at least 1 inch thick, which can bring more glow and kind of thing. No way. You don't need to do that. You just need to do natural process. What is the natural process? Natural process is that you must give yourself 5 to 10 minute daily massage. And that massage again you can just do simple with the warm cold pressed black sesame oil from toes to upward all over the body. You can come up and massage yourself on a daily basis. And now, what is the importance of that in, and how this will work with my menopause or premenopause stage? Simple. It is going to work with your lymphatic system. It is going to work with your circulatory system. And because of the dryness on your skin, all your sweat glands has stopped getting blocked. And when they are blocked, you cannot sweat, even though someone might say, okay, I naturally don't sweat at all, but then that sebum secretions which are happening there, which is keeping your skin in a more protective, as well as the moistness is there, when they block the pores, the heat will start trapping inside the body, and that heat ultimately start impacting you to get hot flushes and other issues. So this massage is not only going to make your muscles more supple, skin getting more and more softer, that aging impact on the skin, wrinkles and other things which start showing, you will never ever have that when, if you have started at the right time. So when you have an even post menopause situation, you will never ever get that. And for face, you can just use even coconut oil, that is perfectly fine, or you can use an aloe vera gel, that is perfectly fine. Otherwise, there are certain natural Ayurvedic skin care products you can look at, but that's not something you need to worry at a first stage. First is your total well-being and how you can move from this phase in a very natural without getting affected with anything. So that's the one part. Now, another very important regime in this phase you need to look at is your breathing, because due to all this aspect of pitta and vata aggravation, anyone who will say that I am a perfect yogi or yogan, right, and my breathing is to the optimum, they will always have a phase where their breathing is always shallow. Shallow breathing means you are not getting sufficient oxygen. And when the oxygen is not there, it impacts on your pH level of the blood, and blood get heated, and that's where another impact comes up. So to counter that, everyone, every woman should start, if she's not doing before, at least 3 to 4 times a day, 10 to 15 deep, long, slow breath, which must come from lower abdomen through your nose, out through your nose. You don't need to get into alternative nostril breathing or anything. Simple breathing, if you do that. Simple breathing means you will be able to provide sufficient oxygen to your cell. Two factors will come up. A, it will help to give more vitality to your cells, so the counter the fatigue and tiredness and irritability which comes up easily. Second thing is, it will help you to keep your blood pH level at a more stable state, and you will enjoy the good transition. Now, another regime which is very, very important, but this is something you need to be careful that if it is too cold, don't do that. But if you are in an environment where even in winter they are not so cold, you can even do that. But if your menopause is coming up in summer, then definitely you can incorporate that. What is that? You must go outside of your house and walk on green grass bare feet for 5 minutes, because the dew which is present on the green grass work on the certain energy points on the sole of our feet, which directly relate with the heart, directly relate with these two glands, and directly relate with the eyes. So in this way, we are able to take excess heat from those organs and make you feel more grounded, and again the impact of the hot flushes and other thing can be minimized. So these are the few things which every woman can start the moment they start seeing some of the issues are coming up. Now, the other factor is in this phase, in menopause stage, as I shared with you, from our Ayurvedic perspective, two elements are what we have to keep an eye on, irrespective of your constitution: Pitta intelligence and Vata intelligence. So, some of the food which, if a woman is eating in her early phase of life, so forget about the time which is gone. But if now you start seeing that changes are start happening, and I can definitely make now conclusion that I am in a premenopause stage, or even the menopause stage has start coming up, and some of the food which I'm going to share, if those are part and parcel of your life, eliminate them and don't smell them at least 2 or 3 years in your phase of menopause, even the post-menopause. But if you can't avoid them to that extent, at least 6 months you must follow very strictly and very sincerely. What are those kind of food? Like say miso soup is there one good thing which you need to avoid. Peanut butter, tomato sauce, tin tomatoes, cheese is your biggest culprit. Then your chips of any kind, chili sauce, soya sauce. If you are not a compatible to the soya sauce, compatible means you are not born in a that culture where soya sauce is a part and parcel of their great 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 grandfathers and mothers and kind of thing. So if you are adopting such food, try to avoid in that phase. Then try to eliminate all kind of chips. Seafood, especially prawns, crabs, mussels, are your biggest enemy during that period. Now, another very, very important part of your life should be to avoid any kind of bread, any kind of muffin, cake, chocolate, even they are organic or super organic, don't even smell them. Reason, sometimes people ask, okay, hang on, why you are telling me now these things? First of all, understand these, anything which is fermented will be impacting you, causing more and more heat in your system, impacting your gut, and leading to one or the other problem. So must make sure in that phase you don't even go near to them even in your dreams. And then another problem many of the women get into, because they feel that this is something will be very very good for me, is carbonated drinks, or even if not carbonated drink, carbonated water. So they don't believe in drinking still water or plain water, don't to talk about the warm water. So they get into carbonated water, so must be out of your life. Just drink still water. If not able to drink warm, at least room temperature. Don't go to the other extreme of ice cold water. So that's another thing they need to look at. And another biggest issues nowadays are smoothies kind of things. That's what they need to avoid. Further thing they need to avoid is their salad, because salad is something which is not getting broken down when your metabolism is already affected. We can talk about that on another day and given a full detailed understanding that how these things are bad for us. So that's the other aspect to talk about. Now, one another thing with the many women who are nowadays facing menopause or going through the premenopause, and when they come, they always talk about that, oh look, I am on an intermittent fasting. And that's where when you look at them, they are like an almost gone case in their life, means feeling fatigued, tired, irritable, all the, you name it, and they have a problem. So when I try to make them understand that this intermittent fasting is one of the worst things for you at that phase, and try to explain them how, and also try to explain that how you can still achieve the objective of the intermittent fasting, which is not bad. But the thing is, we need to look at how this is can be natural, achievable. So that's the whole part. So when you follow the rhythms of the days, rhythm of the season, You can achieve this without any affected, and you can still have to have your breakfast, lunch, and dinner. You don't need to skip those things. Again, their breakfast, lunch, and dinner should be more nourishing, making sure always eat warm and cooked food. That's where they need to always follow. One thing they must, every woman should do, that they must eat a handful of raisin and 5 to 10 almonds twice a day, especially between 10:30, 11 to, and then between 3 and 3:30 p.m., because that's the time their energy levels start going low. So these few things will help you a lot to go through the smooth transition. And then comes up the role of some of the Ayurvedic treatments and the Ayurvedic products, which are very, very effective for this. There is a combination of this set which every woman can use. If you are going through the menopause, or you already in the menopause and you are now going through this all issues of hot flushes or irritable or sleep issues and feeling I might have any bones problems or blood pressure problems or like that, you can use there are two set of product. One is known as capsule express, and then there is a fem power. Fem power is in the powder form, capsules comes in the capsule form. These two you can take twice a day. And then there is a one liquid known as Dashmula Rishta. And if you still having period, then there is another liquid you can incorporate, but that period is now start becoming excessive bleeding, or clotting start coming up, or the periods are start getting lengthy or shortened. So then there is an Ashoka Rishta is another product which combination with the Dashmula Rishta works very well. So that's where you can incorporate and follow them, and you will see the good result. And then some of our bodywork treatment, which again help a lot to bring yourself in a more balanced form and state, physically, mentally, emotionally. One is known as therapeutic Ayurvedic Marma massage and Shirodhara combination. Shirodhara is a very precise Ayurvedic treatment for balancing these two glands and counter the stress and counter the whole mood swings and sleep issues. If the person is not able to sleep even for such a long time and are on even sleeping pill, I can bet with you, if you are given a good Shirodhara by an expert Ayurvedic therapist, you should be snoring like anything on the table. And if you don't snore, I can assure you that therapists, if they are really follow Ayurvedic principle, they don't even charge you even a one single dollar. That's the guarantee I can give you. The type of this treatment is. So that is where this whole aspect of Ayurvedic approach to menopause comes up. Now, some people ask, okay, hang on, why these things are happening? How these symptoms of hot flushes, thinning of my hair, my eyesight issues, my palpitation get more faster? What did that happen? No science in the world can give you these answers except Ayurveda. I'm not biased. Yes, I follow Ayurveda. I'm an Ayurvedic doctor. But where, when we talk about values of various sciences, I'm always of the view that our medical system has its own place. You cannot uh, ignore that. But when we're talking about such issues which can be handled very effectively with your awareness, with your approach to live in a more balanced life. And why Ayurveda? Because Ayurveda can give you the answer. Ayurvedic science, its own physiology, anatomy, pathology, can give you the reason of whatever it has advised us to do that. So now when we are talking about this, all symptoms in the menopause, what Ayurveda talk about? Ayurveda talk about that we have 7 tissues in our body. And the seventh tissue, what we talk about, is known as your Shukra Dhatu, and in that is where this artha means mensurational secretions are happening in the woman. Now, due to the pitta and vata aggravation, when this phase of monthly cycle is coming up, it will start getting a bit affected. And then when the cessation of the periods will happen, every month, as we always talk about, woman has this show for 3 to 5 days. And because it is dominated by blood is rakta dhatu, and blood is dominated by pitta intelligence according to Ayurvedic principle. So when that show is now not happening, what is actually happening? It's a simple analogy we give them, like you have a heater in your house to keep the room nice and warm, comfortable. Now, but in that room, if the ventilation process is there, you will enjoy, you can sit there and still enjoy the warmthness of the uh, environment. But say, for example, you close all the windows of that room and keep the temperature at the same level in your heater. After a while, you will start feeling suffocated. You will start feeling uncomfortable. You start feeling hot now. Right? Same thing happen in every woman. When they are ceasing their periods on a monthly level, what happens that heat will start trapping in their system. And now look at the way Ayurveda has described these seven tissues. They are in a systematic way, one after the other. So seventh dhatu is Shukra dhatu. The next one is the nervous tissue. So nervous tissue means it will then impact your sleep. It will impact your mood swing. It will impact these two glands. Again, as I said, the heat is the biggest culprit for that. Then it will also impact your hairs. It will also impact your eyesight. So those are the things which are naturally affected. And after that nervous tissue, which is known as maja dhatu from Ayurvedic perspective, next is our asti dhatu. So when that tissue start getting affected, that's where you will see the osteoporosis or some kind of pains in your bones and joints start happening, which is very obvious. And then the next one is your mamsa and meda dhatu. So when they start getting affected, because meda dhatu is in a protective tissue which is trying to keep the heat in a balanced state, also give you in a bit of padding and foundation. So meda dhatu also relate with the our various hormonal secretions. So naturally, when that body start depleting, it will start compensating for those hormones, and that's a natural function of the meda dhatu. But in the same way, in that process, some women can have an impact on their weight. That is where your constitution will come into, and some women can start losing weight. And then the next one is your Rakta Dhatu, which is more important. And Rakta Dhatu relate with your heart also. So heart palpitations start getting affected, your blood pressure start getting affected. So that is where that there is not even a one single symptom which is in the menopause, either described by Ayurveda or either described by the Western medicine, cannot be explained and answered from Ayurvedic perspective. So once you able to understand as a client these issues and able to make an effort to correct them in a more natural way, Ayurvedic way, then you don't need the so-called even natural HRT, because there is no such thing what we call as natural HRTs, right? So your body knows what your requirements are more than anyone else. So let your bodily intelligence get revived. Let's make an effort to follow Ayurvedic approach. But again, with the Ayurvedic approach, I will always advise be always cautious that don't follow Ayurvedic approach where you are dominated by just getting pills. You need to follow that Ayurvedic approach where you are able to get in a complete approach with the dominance of your daily and seasonal routines and getting in a bit reasoning, whether it's the menopause or any other ailment. But our focus is on these things, and then must follow in a diet and eliminate all those things. So that's all for today. Thanks everyone, and thanks for joining with us, and hope it helpful.